I want to talk a little bit about child and adolescent psychiatry. I'm board certified in that, and I have providers that specialize in child and adolescents as well. But when I was in training, it was a much needed profession. That's not everyone's cup of tea, for some providers to work with child and adolescents, because the reason is, it is more complicated. And it's not as, I'm not going to say cookie cutter, it's not going to be as your run-of-the-mill, okay, this is really depression here. And I think a seasoned health provider will know that you're not only going to do that with children, but you're going to do that with adults too. What's hard about child and adolescents, especially younger ones, 5 years old and 6 years old, and believe it or not, there are some behavioral challenges that these children may have, and maybe some of you guys know them yourself. Understanding family dynamics, understanding upbringing, understanding any type of genetic predisposition that a child may have in their DNA. Children and adolescents typically will not manifest your true, what I call it, I hate to use the word DSM, but DSM has these criteria for depression. I don't really use those DSM criteria, because I really base it again on functionality of someone. But looking at a child and adolescent and looking at the relationships that they may have and getting to the point of their symptoms of depression or anxiety or even addiction, it may not even be as clear cut. On the surface, it may, okay, well, he's depressed, he's isolating, he's crying. But there are so many dynamics, especially with a brain that's still growing, right? And you're still trying to manage yourself by learning coping skills. And believe it or not, as we grow older, we get more and more wisdom. We hope at least we do. But the more people we interact with, the more people we communicate with, we learn. We learn every day as adults. Children, and adolescents, they look up to their parents, they look up to their caregivers, they look at their surroundings. So, just like I said earlier, an adolescent or a child that might be depressed, or someone may have labeled their child that's 8 years old bipolar disorder, and really, again, they don't really follow the true blue criteria to be diagnosed with depression. Again, to reiterate, the thing about depressive symptoms, I can talk about that in child and adolescents. If you have depression as a child and adolescent, don't always look for sadness and isolation, because it could manifest in their 3 dimensions of their life. Their schooling, you look at relationship at school, how they manage themselves. What's the relationship with adults in school? At home, how do they manage? How do the parents manage? How do they discipline their children? Is there substance abuse going on at home? Is there trauma occurring at home? And then I also just look at social pieces. How do they interact with their peers? Or there's a lot of times where people may bring their child to me and say, well, I think he's angry, he's agitated, and we don't know why. Sometimes it's as simple as talking to your child and finding maybe what's going on. What is the underlying factors that could be causing these behaviors? So again, we talk about developmental history in pediatrics. There's a lot of developmental history to be obtained. So again, it's not as clear cut in child and adolescents, but we do that here. We do a thorough assessment for children and adolescents here at Valbuena Wellness, and we're very proud of it.